Good evening. Welcome to this presentation on the intrinsic approaches to exercise adherence for individuals with neurological disorders. Before we progress, I just want you to take a moment just to connect with those two images there and just think about the physiological impacts that somebody that may have damage to that particular area of their brain may come up against when we talk about barriers to health or even motivating factors as to why we would maintain an exercise program and things like that. So just keep that in mind as we go through this presentation. As I mentioned, that physiological impact that somebody with a neurological disorder may come up against, but also there'd be a level of increased complexity across the board. If we look at things like reasons why not to exercise, or just people's health in general that suffer from things like potentially Parkinson's, dementia, multiple sclerosis, any of the motor neuron disorders, that's the suite that I'm discussing throughout this presentation. Even some limiting factors when it comes to some of the determinants of types of adherence or that kind of thing, they're going to be affected both biochemically and physiologically by the disorder itself and where or how that has manifested symptomatically in the individual. There's plenty of literature out there regarding these disorders when it comes to things like the intrinsic approach of mindfulness. However, in terms of the application, there is less available to date that I've been able to find. However, looking forward to broadening that within the essay component of this. It's fairly broad and non-specific, the literature, however, in terms of the specifics of how and why, but that's understandable in terms of the difficulties associated with measuring some of these things. In terms of the clinical applications, say for somebody that was looking to progress as a exercise physiologist, it's interesting to understand that the pre-screening process may need to, and also are there guidelines associated in Australia for exercise and prescription techniques for this as well. So in terms of exercise behaviour, it's important to remember that a lot of the forms of data collection regarding like neuropsychosis and that kind of thing does come from a questionnaire-based assessment, as well as some other types of data collection. But just bear in mind that when we're discussing the neurological disorder space, it may be difficult to collect data from participants themselves. And then this can then flow on to the potential model and theories that an individual can be classed as. So for example, with the self-determination theory, that social relativity and the individuality associated with performing a particular task, is that level of autonomy cognitively possible for particular individuals that may have that area of their cortex affected by their disorder. Similarly, with the trans-theoretical model, is it possible for somebody to have that cyclic kind of approach to their motivating reasons to exercise or to not maintain a particular program that they may be in the middle of? There's no shortage of literature to back up the fact that physical activity is a benefit that's associated with the general well-being. But we just need to continue to bear in mind that some of the assumptions associated with the studies that have formed the basis of a lot of our approaches to the general population may need to be adjusted for people with neurological disorders. Barriers to exercise, again, it's just really some common sense approaches to the fact that they're going to be more complex in nature. For example, the sedentary lifestyle for a lot of these individuals is not a choice, and that can change the way that they may approach or not approach continuing with physical activity in their life. The lack of support, and I don't mean that just specifically in their environmental and social determinants, but even the lack of education potentially available to professionals out there that are leaders in this space. Cost effectiveness, it's fantastic that the NDIS has come in and provided a lot of access to funds. However, the effectiveness of those funds is still up to the individual, so they need to be educated as to the possible justification of the cost of paying for either a personal trainer or an exercise physiologist to assist with that adherence to their exercise and quality of life through physical training. And then the actual modes of exercise themselves may not suit all those individuals. So traditional models may need to be looked at, as the scope of those potentially needs to broaden and encompass this space so that they're not feeling like they're marginalised further than they may already be in their life day to day. So the intrinsic approach of mindfulness is what I'm going to be focusing on, and focusing on it in 3 phases. So the experience itself, focusing on that as an extrinsic factor in a session, then that potential flipping of that to a more intrinsic and process-focused approach, and then finally that connected mindfulness and purposeful association with physical activity. So firstly, the experiential focus. So this can be things like breathing and connecting to the moment itself and the environment that you are in. So not only psychologically can that potentially assist, but we can also use breathing as a fine motor movement for somebody that may not be able to do our big traditional biomechanical angular moves. So breathing is very much supported. In particular, there's some great studies in the multiple sclerosis space regarding this. Problem-solving physical activities, so countering the fact that they may be doing an exercise by making it into a game or a puzzle. And then being very aware of the environment. It may need to be stimulated or actually desensitized according to the types of symptoms that an individual may present with that has a type of neurological disorder. And then we have that sympathetic nervous system normalization techniques. There's lots of support out there for that as well. In each of these sections, I've just put a little note in there about some leadership qualities of the clinician or the practitioner that may be taking care of the individual. So in this approach with the experience type approach, that leader who is either prescribing those exercises or monitoring this participant would need to really focus on individualizing the feedback, even if it was in a group setting, because that's very important to this type of moderator being effective in helping somebody adhere to their exercise regime. So then we're going to move on to a more focused approach in terms of the process itself, and it really comes down to the individual in this space. So this can be achieved by routine types of programming, making sure you're aware of whether a periodized type of session week to week is going to work, or do they need something different every time you see them. And then effective progressions. Can they actually feel throughout the process what's happening? And the application of different types of new or innovative exercises is where this can be applied. So we're talking about things like body play and flow, light trainers, things like that, things that you may not find in your traditional gym setting. And leaderships in this space, the qualities that we have just noted there would be someone who is potentially a little bit more creative and adaptable to an individual, maybe not being the same week to week. So in my experience with clients that have it, in particular multiple sclerosis, they can present one week in a particular way and then walk in the next week and symptomatically have something completely different that is heightened for them on that day. So the adaptability piece is key there. And finally, just connecting with purpose and meaning within the reasoning why they are doing what they're doing. So again, down-regulating the sympathetic nervous system, be that through some breathing techniques or some other form of smaller movement, allowing the individual to understand that it is a safe place to be. And discovering personal interests. So again, coming back to that pre-screening guidelines, there may need to be some level of broadening the scope there within your initial interactions with somebody like this to understand what those personal interests are so that this approach could then be applied. And just consistent reinforcement and association, so getting them to connect with the feeling itself and potentially even the feeling in their body, as opposed to our experiential focus where we want them to potentially dissociate from that feeling in itself. And a leader in this space would need to have a level of empathy associated with the possibility that they're going to have to relate at a different level to an individual to understand what and why they are doing what they're doing, and be a part of that journey with them as well. So just in conclusion, studies are well and readily available in this space, and I look forward to further investigation for the essay on this topic as well. But definitely a deeper assessment of literature would be required from my perspective in order to gain an understanding of if there are actual guidelines that we can use and adapt to suit these individuals within the current scheme of exercise prescription, and helping to better their quality of life by hopefully getting them to adhere to those programs, either with an individual or in their day-to-day life as well, if that's something that's prescribed to them.